Hi, and welcome to the VieSID Press-release. With this short presentation, we want to report on the dental literature published in October 2021. We have chosen articles from a selected list of journals that we think might be of interest to the VieSID community. We start with some papers published on the Journal of Oral Rehabilitation. Note that this journal publishes the review history alongside the articles. Agarwal and colleagues evaluated the outcome of an intervention on patients suffering from orofacial chronic pain. The intervention consisted in educating patients about their condition through in-person or online meetings. The facilitators helped the patient understanding the effect of their condition in their life, instructed them on how to communicate about their condition with others, and possibly correct some behaviors such as posture. The authors found that their intervention had a significantly positive effect on the TMD patients, but not on the burning mouth syndrome patients. However, a high dropout rate for the study was registered, and in fact 16 patients were recruited, but only 22 actually completed the program, and this high dropout rate is not explained in the paper. Barbosa et al. Assessed the oral habits in a sample of over 1,000 students from a Portuguese university, including TMD subjects and controls. They used the oral behavioral checklist, which includes diverse oral habits, the most diverse actually, such as clenching and grinding, but also unilateral chewing, playing mouth music instruments, or eating between meals. They found that clenching and grinding are associated to painful TMD. However, they also noticed that the checklist might be revisited because the oral habits considered are very heterogeneous, and also the directionality of their effect on TMD is uncertain. Also, I noticed that the total score that one assessment can deliver goes from 0 to 84, and values above 24 were already considered overuse of the oral structures by the authors. Thus, the rate of the percentage of overuse might be overestimated in the study. Here we have an article by Billard et al. In which the changes in head position between sitting and standing were assessed. These authors measured variation along 3 possible axes. So they measured the pitch, so the rotation up, down of the head, yaw, so right to left, and the roll, that is the right to left tilting of the head. And so they eventually found that the individual while sitting had a more elevated pitch, so they were sitting chin up, and while when standing there was a higher variation in the roll, so on the right to left tilting. I would still be curious here to know whether the volunteers were instructing as to whether they had to keep their teeth into contact or not. Egg and colleagues instead carried out an explorative study on the aspirin blood level in TMD patients. Aspirin is a small leucine-rich proteoglycans, so it is a complex protein that is present in the extracellular matrix of cartilaginous tissues, but is also a biomarker for some cancers like prostate cancer, breast or stomach cancer. And it is elevated also in subjects that suffer from osteoarthritis. They considered therefore 43 TMD individuals and 43 controls, and found a significant difference in aspirin levels between study and control males, but not between females. So they didn't consider at the beginning of the study, so while designing it, that sexual dimorphism might play a role, and therefore the initial sample size might be too small when broken down in 4 subgroups. So thus, I can see this work as a very interesting pilot study deserving further investigation. Janel and colleagues carried out an experimental study assessing the muscle response of women affected by chronic myofascial face pain. These were subjected to different stressors such as cold pressors, mental arithmetic, reaction time to startle response, and speech stressors. The authors did not find significant differences in the response of TMD patients and controls, if not in the reaction time to startle response stressor. So, being this the only positive outcome, the authors interpreted these results with the necessary caution. And the study, it seems, it was a lot of fun for the authors and probably the participants too. And the authors actually managed to demonstrate that experimental stressor did provoke an immediate stress in the response, so a stress response, and they assess it through the blood pressure values. But nonetheless, they found that the muscle activity was not significantly different. However, what is interesting here to know, this is probably so at least one information that is very interesting that I found in this paper is that what they reported is that the baseline, the study group had a higher level of stress than the control. So it seems that the effect of time was not considered here. And additionally, the study group showed moderate symptoms. And so I wonder whether including patients with severe symptoms might have changed the outcome of the study. So now let's see what Cranio had in store for us. So Karaman and Sadri evaluated in the study the TMD symptoms in about 1,500 early and late adolescents that were distinguished between normal weight, overweight, and obese. They found that actually the TMD symptoms were more prevalent in overweight and obese individuals, especially muscle pain and TMJ clicking, and explained these outcomes with the fact that the obese patients tend to eat softer food and thus have weaker masticulatory muscles. Also, the prevalence of decay and thus of missing teeth is higher in obese people. I would like to add that I think we can expect also obese people to show higher level of body inflammation, so in general. Kim and Kim evaluated the sleep quality in a sample of TMD patients, distinguished between muscle pain, joint pain, or combined. Interesting, they found that in the 3 different groups, at least 75% of the patients suffer from sleep disturbances. Even more interesting would be to understand what is the causality here. In this paper by Magri and colleagues, the effect of low-level laser therapy on a small number of TMD patients, so 41 in total, was investigated. The pain score was assessed at baseline immediately after the first treatment and after 6 months and 12 months. The authors found that both laser and placebo group responded well to the treatment. At 6 months, the patients were informed about the kind of treatment they received and whether the information was given before or after they reported the pain level reflected in fact in the results. Also, by comparing the outcome of the laser treatment to the placebo, it seems that this kind of laser therapy is not more beneficial than the placebo. Yes, next slide. So we have here an editorial of the Journal of Prosthetic Dentistry by Professor Babel. Here Baba discusses the benefits of digital dentistry, including time saving, reduction of CO2 emissions, and easy data storage and sharing, which make it easy to replace or fix dentures promptly. And while we are all still trying to catch up on the new digital techniques, Professor Baba is already a step forward. He's inviting us to think how digital dentistry could be advanced with implementation of artificial intelligence. So I'm reporting also on a work published in the Advanced Dental Technology and Techniques. This open access journal was founded in 2018 and does not have yet an impact factor, but I invite you to take a look at it since it seems focusing on topics of interest to the VieSID community. Here, in particular, I want to discuss the article by Matos et al., which was divided in two parts, but I will discuss it briefly in as one work. So these authors address the question as to whether temporomandibular disorders are actually of somatic origin. In fact, it has been suggested that TMD patients experience symptoms that are not driven by a somatic condition. Therefore, these are somatic disorders. So 6 treatment centers joined forces here and evaluated the outcomes of different kinds of mechanistic treatments to TMD patients. So these treatments were administered were varied, including immediate complete anterior guidance development, coronoplasty, exercises, ortho and prosthodontic treatments, and medications. And after 3 to 4 months, the patients were evaluated again, and then so the function of the mandible and the pain score and the function of the TMJ were scored, and an improvement was noted. Also, there was a significant decrease of reported general health problems or symptoms that demonstrated that mechanistic approach to the treatment of TMD have also an effect on the psychological profile of the patients. So this presentation terminates here. I invite you to contact us in case you want to know more about our activities. Otherwise, be ready for next month's press release. See you soon.